Hey everyone, we are live. Welcome to this great panel discussion we have here. I'm going to wait a minute while people jump onto this live stream, so we make sure everyone gets the right information. They know who's at this panel and what we'll be talking about today. So if you are in the chat, just let us know where you're tuning in from. Let us know too, as we go into these topics, what specific questions you have. This panel is going to be really beneficial for you if you bring your kind of genuine individualized experience with navigating work right now. So without further ado, my name is Ashley Kristoff. I work for The Mighty. I'm going to be your moderator for today's panel. Today's panel is called The New Normal, Navigating Workplace Disruption During the Coronavirus Pandemic. Unfortunately, something we're all too familiar with at this point. So this talk is going to be with subject matter experts on how to find a job that fits your needs, talk to your employer about access to care, and find resources to make ends meet during this pandemic. So if you have any questions about any of those topics, we're going to be covering a lot today, but we really want to know what you guys want to learn and know about these things that will benefit you in your kind of job search. So without further ado, let's start with Hannah. Do you mind introducing yourself?
Yeah, absolutely. So hi, everyone. My name is Hannah Olson, and I am the founder and CEO of Chronically Capable, which is an employment platform that helps individuals with chronic illnesses and disabilities to find flexible jobs. I myself am chronically ill, and I unfortunately had to leave what I thought was my dream job out of college due to my treatment schedule for Lyme disease. And so taking that experience, I decided to start this business, and we work with employers across the nation to help find employment solutions for the chronically ill and disabled communities.
Great, thank you, Hannah. Next up is Shelly.
Hi everyone, my name is Shelly Gyves, and I am a partner in the corporate department at Katten, which is a law firm with offices throughout the country and the world. I'm based in our New York office. I specialize in employment and labor matters. Among a variety of other issues, I have experience working with clients on issues related to diversity and inclusion. And I've done extensive work in the last few months counseling employers in connection with their response to the coronavirus pandemic, including helping them to navigate the various new laws that have been passed. And so I'm here today to talk to you a little bit about those laws and how they, they impact the workplace and seeking work during this challenging time. I would be remiss if I didn't say that, this shouldn't be taken as legal advice, but I'm happy to talk through the issues and excited to be here. Just on a personal note, I am joining you today from Chatham, New Jersey, where I live with my husband and 4 children, ages 11 months to 8 years. And I'm very much hoping that they do not join us today, although I cannot make any promises. Thanks a lot.
Yeah, that is a good note. We are all working from our homes for the most part, so there will be the option of interruptions from our lovely guests who live with us. And so without our last guest is Clorinda.
Hello, everyone. My name is Clorinda Walley, and I work with an organization called Good Days. I've been with the organization for 13 years, when what we focus on is trying to remove barriers for people suffering with chronic and life-altering disease who are trying to access medication, treatment, have trouble getting to and from their doctor's appointments. I've been in healthcare for most of my life, and I always thought that I understood what people were going through who were ill, and the people that I serviced in specialty pharmacy. And I never really got it until I was diagnosed at the age of around 35 years old with an autoimmune disease. It clearly opened my eyes to the different struggles that people suffer with, not only physically, but also emotionally. I believe that I was always, I always had control of my life and what was taking place. And, the moment it was me, it's kind of like I forgot everything and had to relearn how to navigate, how to manage 3 children. So it has certainly been an eye-opening path for me, and I'm forever grateful that I have the opportunity to now take what I've learned and what I've experienced to help others. And from a personal note, I have 3 sons, 18, they always get mad at me for this, so 18, 15, and 12. And I have an 80-year-old mother who lives with me who also suffers from chronic illness.
Great. Thank you all for joining for this panel today. And yeah, hopefully this is a really good resource for everyone in the community. I know we all kind of have these lived experiences in one way or another that makes, you know, all of your voices very helpful in this time. So let's jump into our first section, which is really talking about safety returning to work or the workforce. So whether you are at home working from home right now and you're getting ready to go back into your workplace, or your company's getting used to it, or you're looking for even a new job and you're kind of wondering what's going on there. So let's start with this. I have a health condition that makes me particularly high risk for complications if I were to contract the coronavirus. Can and should I approach my employer to talk about this?
So I'm happy to take this one, Ashley. And the answer is yes, you definitely can and should. Under the Americans with Disabilities Act, which is often referred to as the ADA, employers have to provide what are referred to as reasonable accommodations to employees with disabilities that will allow the employee to perform the essential functions of their job. And so reasonable accommodations are those types of accommodations that don't pose an undue hardship on the employer. And due to this pandemic, certain health conditions may impact your ability to safely do your job, even if it wouldn't have had any sort of impact in the past. And so it definitely makes sense to approach your employer and to talk about this so that you can engage in a dialogue and figure out whether and how your concerns can be accommodated and can be addressed. So examples of accommodations that might be reasonable depending on the circumstances, or maybe, you know, continuing to work remotely if you are able to perform the essential functions of your job from home and there's no undue hardship on the employer of allowing you to do that. Other options might be, you know, maybe you'd be provided with a separate or an enclosed office space if normally you would work in, you know, a cubicle or more out in the open. Maybe you would be allowed to work or to commute during off hours to limit your exposure on public transit during rush hours, things like that. So, you know, there are a variety of things that that you can talk about with your employer and that can be done, but you need to start that dialogue. And I think an important thing to know is that you shouldn't assume that your employer will approach you necessarily to offer you these accommodations or to require you to take any of these steps. You know, for some employees, an employer might not even be aware that you have some sort of underlying health condition, especially if it never had an impact on your work before. And there are some legal restrictions on an employer's ability to survey its employees to try to find out about underlying health conditions. And even if an employer does know about a health condition, employers are really limited in what they can request or require of employees who haven't specifically said that they need or want an accommodation. And so, you know, I think the best approach is, you know, transparency and approaching your employer with, you know, with a view towards engaging in that dialogue and seeing what makes sense.
Great. And I think jumping kind of into that, so that's kind of talking a little bit more about what you can kind of do as an individual, but thinking of the workplace as a whole, how might employers consider modifying their work sites or workplace practices in light of COVID-19? We know we need to make these locations really safe for people to return to work, you know, especially with some of these companies opening up right now. Like what new practices can people bring?
Yes, I'm happy to jump in on that. So first off, what we're seeing in terms of how the whole thing has shifted for all of work, really, it's just been this big shift in remote work. So right now, obviously, many companies who are not considered essential are working remotely, but going back to work and thinking about modifying the work sites and the workplace practices in general, we have to think back to what Michelle was talking about and looking at the ADA, and employers must continue to provide these reasonable accommodations to their employees during this time. So for example, someone who might have asthma might be able to ask to work from home as a reasonable accommodation, and that's due to the high risk that exposure to the virus from other coworkers in a crowded workspace might affect them. So the request to work from home may be a reasonable accommodation, even if your company doesn't actually have a policy allowing it. Also, employers should really focus on the resources that they do have in place. One of the things that many companies have but don't often advertise are employee assistance programs. These also can be known as EAPs, and these can provide a variety of support ranging from behavioral and mental health services to counseling and other wellness support. And these serve as kind of that first step that can actually guide your employees to other work or health-related resources. So it's important for employers to think about their community and specifically focus on what they have in place and begin to put into effect the things that they actually do have.
Yeah, and I would like to comment on that as well, Ashley. This is new to many organizations, and just looking at Good Days, we have 50 people who work in a very close-knit environment, many of whom have a chronic illness or are taking care of somebody with a chronic illness. So it was certainly, we had to move really fast to try to figure out and adapt, how can we continue to take care of those people we serve while also taking care of our people that are serving them. And so, we immediately put into action a work from home. We have a small group of people coming in 2 days a week to handle any mail or other types of things that are coming in. But it is certainly, speaking not only from a chronic illness perspective, but from an employer perspective, it was something that we had to adjust to quickly, and it continues to change. At this point, for Good Days, we'll seek counsel from Katten to say, what are the different things, not that we have to do, that we should be doing, as we want to continue to protect our employees and the families of our employees. And so we'll continue in our environment to work from home. And, we've been fortunate enough to have the opportunity and the capacity to do those types of things. But like you said before, I highly encourage anyone who is suffering from a chronic illness or taking care of someone who is elderly to speak with their employer, because this might be new to some, and it's not that they're not willing to help. They may not know how to or what is needed. So I highly encourage anyone who has fear or who could be highly susceptible to the complications of COVID to speak frankly with your employer to try to get the accommodations that are needed to keep you healthy and safe.
Yeah, for sure. And I think that's something that we are really seeing across the board. There are so many companies that are working from home. I know that at the Mighty, we have 2 offices where we came in, but we've been, since this whole thing began, we've been working remotely. And with that, we had a lot of these kind of conversations up front about, we know people are going to be at home that weren't used to being at home. There's going to be the factor of kids. There's going to be the factor of pets. So just being a little extra forgiving during this time, I think is something that I think a lot of employers can do, since we're all kind of in this together. So let's just jump into kind of how employers are responding generally to COVID-19. So what hiring trends are we seeing? We hear a lot about the other side of things, the layoffs and the kind of unemployment news, but what's going on with hiring right now?
Yeah, so a lot of people have said that they're getting laid off, and this is a big trend that we are seeing. Unfortunately, many companies have had to make these decisions due to their lack of resources, but there are many companies that are hiring right now, and I think that that's something so unique about this, is that there were so many opportunities that came up based on how we react to a pandemic. So we're seeing all of these different industries popping up, the food delivery industry, the remote work, and different types of fields that may not have been as popular per se are now starting to boom. So there's definitely hiring going on, and I think employers are continuing to do their best to support their current employees and to also still onboard new support. But obviously the biggest trend that we're seeing is really this switch to remote work. So in the news this week, Twitter, which has notoriously been a huge company, has now decided to allow their employees to work remotely for the rest of forever, not just through the calendar year. So I think we're going to start to see more companies like this starting to adapt and to create more flexible schedules, which for us at Chronically Capable, this is so important because this is what we've been pushing for the last year and a half, is to really try to get employers to understand the need for flexibility. And so I think before all of this, people weren't talking about being sick or needing to work remotely. And now it took a pandemic, but this is something that we're starting to see as a shift, really, from the employer perspective.
Yeah, and that's something I think really great to note, because we do have all of those, people. I know you're very familiar with working with people who do have restrictions that don't allow them to go into an office. And prior to this time, that was a really, really big requirement of a lot of these workplaces that, we're not seeing as much because people can't go now. But with that being said, we have to consider a lot of hiring really used to happen face to face. So how is, COVID-19 impacting how you're hiring people and what the hiring process looks like, for work from home?
Yeah, so I think it looks very similar to the way it looked when things were in person, but they're just going virtual. So interviews are taking place on Zoom and different platforms like that, and they're stemming beyond being able to have that human-to-human contact. But as a country and globally, really, we're going to see a lot of change after this, and we're not even sure if a lot of companies are going to go back into a traditional workplace environment. So I think companies are just adapting really quickly and trying to kind of make their ends meet. I know, Clorinda, you said that things kind of happened so fast that companies didn't have a time to react. But I think that since it's been now 2 months or so, companies are starting to kind of learn how to use these different virtual platforms and utilizing different companies that are helping support these hiring initiatives. But things are still happening. Employers are still hiring. Things have gone virtual. So, and who knows, because this might change things for the long run, and we might see many companies joining on to this and keeping this past, the length of the pandemic.
Yeah, and in the comments, I'd actually love to know if you have been impacted, like if your work is now switched to work from home, how has that experience been for you? Or if that's a conversation that's still kind of ongoing with your employer, feel free to write that in. Clorinda, you looked like you were about to say something.
Yeah, again, I think that it's interesting. We're, again, I'm going to speak as an employer. These are things that we're all learning, and I think that more and more you're going to figure out, there are many things that can be done remotely, and having the ability to work within your workforce. And again, when you're looking at hiring and talking to people, I think it very much looks like what we're doing here on Facebook Live. We're all learning new technologies, but I certainly have come to realize that we can accomplish a lot, and it's not a matter of where you're at. It's what you're doing and how you want to be focused.
Yes, definitely. Well, so the last section of this conversation about kind of safety returning to work is this. I've been working remotely, or I've been laid off, or I've been furloughed, and I'm expecting to go back to my workplace soon. So what should people expect when they go back to work? Will their employer be taking their temperature, asking about their health, or testing them for coronavirus? Will they be permitted or even required to wear a mask? What is the kind of future of in-person work look like right now?
Yeah, thanks, Ashley. So I think it is going to look pretty different, at least in the sort of near to medium term. The EEOC, which is the federal agency that enforces the ADA and other federal employment laws, has said that that employers can, consistent with the ADA, take employees' temperatures, inquire about the presence of symptoms that are associated with coronavirus, or even do diagnostic testing for coronavirus. And what we're seeing is that a lot of employers are planning to implement some or all of these types of procedures. And in fact, under some of the executive orders that are reopening workplaces in various states, they're really required to, for example, I believe it's Ohio, requires that employers have, every employee do a self-assessment every day for symptoms of fever or other coronavirus related symptoms. And so, I would expect in a lot of workplaces that you either will have your temperature taken or will be required to say that, to promise that you have taken your temperature that morning and don't have a fever. Masks are also something that I think that you're going to see in a lot of workplaces. I actually did a webinar yesterday with some of my colleagues at Katten, and we had about 1,000 people on. And in response to a poll question, 90% of the respondents said that they were planning to require masks for employees or customers in their business when they go back. So I think it's going to be very common that will be required, or at least allowed, especially if you're not working, kind of individually in a closed off office. And then to go back a little bit to, some of the questions you were asking before about, what sorts of things employers are doing. I mean, I'm sure all of us have been to, grocery stores where we've seen, new signage marking off 6 feet of space or arrows on the floor marking footpaths. And I think you're going to see a lot of those same types of measures being taken in other types of workplaces to help to encourage social distancing, kind of the in-person meeting, when not necessary is probably not something that, that you'll be seeing for very long. I think a lot of companies are taking another hard look at their travel policies and really reconsidering what sort of business travel is really essential. And so, I do think that there will be, that the workplace is going to look pretty different when we go back than it did when we left in February or March. And I think it may stay that way for a long time.
Yeah, I don't know that this is going to be going away anytime soon. I think it's going to certainly take us through the end of the year. And from a Good Days perspective, we're going to be very conservative. There's a whole new dynamic of the different things that we need to do to ensure that everyone is protected. And some of the things that we're looking into here is, there's different types of products out there that where somebody can stand in front of a computer and it can take their digital temperature. So we're certainly looking at things like that. Today, if I wanted to go buy Lysol to disinfect the office, I'm not able to find it. So we're going to certainly take it slow and conservative. And we have the luxury of having everyone from our organization to work from home. But as we continue forward, these are kind of like processes that we're going through slowly. We're examining all of the decisions we're making and wanting to ensure again that we're not only protecting the people that work for us, but we're also continuing to help those who have need.
Yeah, absolutely. And yeah, I definitely I see that. I mean, LA County, which is where one of our mighty offices is based, has been extended for another 3 months at this kind of stay-at-home order. So I think we will see in these kind of phases, but two, just there is going to be this extension that people will have a little bit more time to prepare for this new way of working. So I do want to highlight a couple comments from the community that came in around this topic. So Kathy said that her husband has been scurrying like crazy at times, trying to keep everyone connected as he does IT for small businesses, like connecting through Zoom, etc., and making sure that there's enough bandwidth to support remote work. That's definitely just this new area that, we did have remote work before, but not to this level. And I'd like shout out to the IT industry for keeping us all connected, because that's such a vital key to making sure that businesses are able to operate right now and people are able to talk to their friends and family. So thank you to your husband, Kathy. And Samantha said that it's definitely an adjustment working from home, pros and cons for both, but it's helped working from home while schools were closed to help keep us away from the general population and crowds. So thank you, Samantha and Kathy, for sharing. All right, let's hop into our kind of next section. So this is really going to be helpful for if you've been laid off, you've been furloughed, you're kind of in a situation like that. The first real question that I know everyone wants to know is, who's hiring right now?
I'm happy to jump in on this. So, at the same time as people are being laid off, a lot of companies are still hiring during the crisis, and they do need to fill these essential roles more than ever. So a handful of national organizations announced that they are hiring, some of which are Walmart, Amazon, 7-Eleven, Walgreens. These are just some of the major national organizations that are hiring. But as I said before, I think it really, when you think about what do we need, what are the essentials when something like this happens? So think about those industries. So food delivery is huge right now. Amazon, these types of things that we all still need to survive. And I think that those are the industries that are absolutely hiring, as well as a lot of customer service roles are coming up due to the fact that big companies like an Amazon just have this big influx in orders, so that they need to keep up with the demand. So there's tons of companies that are still hiring. One thing I'd like to add is that we do, through the Mighty, I actually help them to co-write a monthly jobs list that goes out on the first of every month. And there we compile a list of companies that are still hiring. The last few have been focused on specifically companies that are hiring during the pandemic. So I encourage you to check those out, because that's a great resource for the community as well.
Yes.
For sure. And I do want to kind of follow up with that. So a lot of those jobs are kind of in-person jobs. Is there any like telework specific companies that are hiring right now?
Yeah, absolutely. So one thing I would encourage people as well to do is to, if you haven't heard about Chronically Capable and you haven't joined on, I encourage you to check it out, because our focus is really, our bread and butter is flexible work, specifically remote work opportunities. So any employer that's on there is employers who have the bandwidth to support a remote team. So we've got several employers on that are hiring right now. There's over 25 different employers up on the site who are actively hiring. One of which that I'd love to shout out is Wikimedia, which is one of the world's largest global nonprofits. They're currently hiring for over 25 positions on the site as well. So telework is obviously, it's not affecting these industries because they were already working remotely. So it's a little bit different in terms of their team and what they're looking for. So I encourage you to check out, again, that Mighty's job list that comes out on the first of every month. And then also, if you haven't checked out Chronically Capable, please do, because we're working really hard to make sure that there's enough opportunities on there that are remote and can support our community.
Absolutely. And I'd love to know in the community if any of you have gained jobs during this time. We'll love to either celebrate your successes or see, the kind of companies that you've been able to find work at right now. That might be a little bit helpful for some others in our community who maybe don't know where to start. So next question is, if someone's laid off or can't go back to work because of the coronavirus, how do they kind of keep the lights on until they find new work?
Yeah, so I'll take this to start off. So I think everyone's aware, always that there are state unemployment benefits that that individuals can apply for if they do lose their job. And under the CARES Act, which was the second sort of big piece of legislation that was passed at a federal level in response to the COVID pandemic, there's been some expansion both in the amount of benefits that people can receive, as well as eligibility for unemployment where it might not otherwise have existed. So, first of all, the CARES Act provides that employees who qualify for unemployment at this time will receive an additional $600 per week on top of the amount that they otherwise would have been entitled to under their state unemployment system if they lose their job as a result of the COVID-19 pandemic. And right now, that $600 per week, that extra $600 per week will be in place for any weeks of unemployment through the end of July. The Democrats in the House have just put forth a new piece of legislation, which they refer to as the HEROES Act, and that would extend that enhanced unemployment benefit through the end of this year. So, we'll keep an eye on that and see what happens. CARES also expanded, and this could be really relevant for, some of the people who are listening, also expanded unemployment benefits to some who otherwise would not have been eligible for assistance. So people who, for example, are self-employed or who are independent contractors historically would not be entitled to seek unemployment benefits, as a result of the downturn in their work through the regular unemployment system. And the CARES Act did expand eligibility to those individuals. It also expanded eligibility for people who have had to leave their jobs or have, for example, had to decline to return to their jobs, as a result of certain COVID-related factors. So, it's not the case that, any person can just quit their job because they have a generalized fear of COVID or, refuse to return to their job if they were furloughed, but if you're someone who has an underlying health condition or who lives with someone who has an underlying health condition or are otherwise at particularly high risk, or if you have, for example, children at home that, their school or their childcare is closed and you don't have any more leave available to you and therefore, either have to leave your job or can't return to your job, you may still be entitled to unemployment benefits in that situation where in normal times you would not have been, so that can be really helpful. And there have been some other changes as well. I mean, I won't go into total detail, but the CARES Act also expanded people's ability to access loans or withdrawals from retirement plans above the limits and, without the penalties, some of the penalties that normally would be in place. And so, those are other avenues that you might consider to help kind of bridge the gap until you are, better able to get back to work.
I'd like to add to that. And so there are so many different organizations out there that are currently providing COVID support. Good Days is one of them, but I'm going to share a list with the mighty, and we'll keep that list updated on a weekly basis. But I'm just going to shout out to a few organizations to give an example to the audience of the different type of financial support that's available to you. There's an organization called HealthWell Foundation. And today they're providing $250 to anyone who is either, they have a member of their household who is diagnosed with COVID, or you're a member of a household that has a high risk group, or you yourself are immunocompromised. And you can use that $250 towards food delivery, delivery of medications, diagnostics, transportation, Patient Access Network Foundation, Lymphoma Leukemia Society. So there are many organizations who are providing financial support. Good Days is providing $250 towards transportation, food delivery, any household items that might be needed. And if you're looking at, you might think, well, I may not qualify. For the most part, there's either no financial qualification necessary, or it's up to 5 times federal poverty level. So to give you an example of what that is, that's about anyone making less than $100,000 a year can get this support. And again, you can get the support from multiple organizations, but we will make sure to post live the different organizations that are out there to help. Enrolling for the programs probably will take you less than 5 minutes, but I highly encourage anyone who needs money for food, for medication, for transportation to key into all of these organizations and see where they can help. Also available through Good Days and through many other organizations is just psychosocial support. So if you just need somebody to talk to or are struggling and you don't know which way to turn, you can go to mygooddays.org, and we have a live chat. You can speak with any one of our employees who are working from home and see, where we can help. So if we can't help you, we'll try to find you someone that does. But know that there's assistance out there, financial assistance, if it's needed, and don't hesitate to apply.
Thank you, Clorinda. Yeah, there are so many great organizations that you can go to at this point for all of these financial supports, and like Clorinda mentioned, even just emotional support during this time, just someone to talk to. We have on the Mighty itself, on the Mighty app, we have a coronavirus group where people are asking about support as well, and just it's also a great resource for people. I do want to highlight Bonnie's question before we move topics a little bit. So nothing listed as to whether you could receive unemployment. I'm not sure if PUA means anything to any of you. If you work PT and receive disability, does anybody have any insight on this?
Shelley?
Oh, I'm having trouble hearing you, Shelley.
Oh, sorry. It's going to depend on, on where exactly you live and on your specific circumstances, but at a high level, if you are working part-time, and you're working part-time as a result of the pandemic when previously you were working full-time, you may be eligible for unemployment assistance, partial unemployment assistance in that situation to increase the amount that you're receiving, that shared work program would allow for that. Sorry, I'm getting a little bit of feedback. Sorry. And so, I think it's really going to depend on the specific facts and circumstances.
Yeah, sorry. Seems like we're having a little bit of feedback.
I'll mute my mic.
Okay, hopefully we're gonna be okay. Sorry about that, everyone. It's the joy of working and running everything from home. So hopefully we can hop that on. If it may be helpful if you grab headphones, that might solve some of the issues. If you don't have them available, we'll try to work around it. Okay. So kind of the kind of next area we really want to jump into is if you do get sick, if you qualify for sick leave, some other kind of financial assistance areas. With that being said, sorry, I lost track of where I was. I do want to mention that this video will be available for replay. So if you know somebody who would benefit from some of the resources that Shelley or Clorinda or Hannah listed earlier, whether it's a workplace resource or an employment financial resource, this will be available and archived after this live time. So please feel free to refer to it if you want to grab any of the resources that anyone mentioned. So hop in. What if I get coronavirus? Do I have to tell my employer? Is everyone going to find out?
So you may and probably will need to tell your employer. I think many employers, for the protection of their workforce at large, are putting into place policies requiring employees, especially those who are working in the employer's physical workspace, to let the employer know if they are experiencing symptoms of coronavirus or have tested positive or are presumed to be positive. And if that happens, you may find that the employer may talk to you about who within the workplace, either colleagues or customers or vendors, that you may have had any sort of sustained close contact with during the prior couple of weeks. So more than less than 6 feet of contact for any kind of extended period of time. And that is so that the employer can let those people know and possibly require them to quarantine at home. But under the ADA, the employer is required to maintain your confidentiality regarding that. And so although the employer may be letting some or all employees know that someone has tested positive for COVID-19, they won't be telling your name or disclosing any other sort of identifying information when they do that. And so, your confidentiality should be protected. Some employers may offer you the option of waiving that confidentiality and allowing the employer to say that it was you, and generally that should be completely voluntary, and up to you whether or not you're willing to have your name shared. So you probably do need to let your employer know, but it's not as though that's going to be broadcast, and everyone would find out that it was you.
For sure. And yeah, so if you do get sick though, is there sick leave or other paid leave available in the event you are impacted by COVID-19? So we've talked about the Families First Coronavirus Response Act is one of the examples here. What protections or benefits does that law provide?
Yeah, so whether there's going to be leave available if you can't work because of some sort of COVID-19 related circumstance, again, it's going to depend on a variety of factors, including, who you work for, where you're located, and, what exactly the situation is that's preventing you from working. So, Ashley, as you mentioned, the Families First Coronavirus Response Act, is kind of the other of the two main bills that have been passed so far in the wake of the pandemic. And that law introduced 2 new paid leave entitlements for individuals that are impacted by coronavirus. And the interesting thing about this law is that there were also tax credits passed to fund these entitlements. So when employers who are covered provide these paid leaves, then they're able to be paid back by the federal government for the amounts that they pay. As that law currently stands, those paid leaves are only available to employees of private employers, which are non-governmental employers that have 500 or fewer employees. But I will note that new HEROES legislation that I mentioned was just proposed this week by Democrats in the House would change this so that it applies to larger employers as well. So, that's something that we'll keep an eye on. And these new leaves are currently in effect through the end of the year. And basically what they do is provide up to 2 weeks of paid sick leave if an employee is unable to work, either because he or she is sick or exposed and required to be quarantined or isolated because of their own COVID-19 diagnosis or symptoms, or because they've been exposed, or if the employee has to care for someone else who has been exposed or who is sick, or has to care for their child whose school or childcare provider is closed or unavailable. So that's an initial 2 weeks of paid leave for any of those purposes. And then there's an additional, up to 12 weeks, so 10 additional weeks that's available, but that's only available in the limited circumstance that someone is unable to work because they're caring for their child whose school or childcare provider is closed. So, those leaves are available to a lot of employees, but not all. But even if you don't qualify for one of those, for example, because you work for a larger employer that's not covered, there may be other leaves that are available. So some states have passed new leave entitlements in response to the coronavirus pandemic that may have broader coverage than the FFCRA leaves that I mentioned. Or, there are certain pre-existing leave entitlements either under state or local law, or under your company's policies that might apply. And this will depend in large part on what the reason is that you need the leave. So if you need the leave because you're sick or because you're caring for someone who's sick, then you might be entitled to time off under your company's paid sick leave program, or under a pre-existing state or even federal sick or family and medical leave law. But if you need leave because because you've been exposed to coronavirus, but you're not currently sick, or you need leave to care for your child whose school is closed, then you might not meet the eligibility requirements for sick or family and medical leave, but you might be able to take advantage of, vacation or PTO or, some other kind of specific leaves like that. So it all depends on the circumstance, but there are a number of entitlements available, and particularly new entitlements being passed to try to help people out in these situations.
Yeah, for sure. So we have a great question from the community that I want to highlight here. What do you do if you are working from home and are physically capable of continuing to work and wish to? Do you have to tell your employer that you have it? Would it be a problem if they somehow happen to find out about it later?
Yeah, so I mean, I think in general, what employers are worried about is people who are coming to the office, and so I think that in most situations there would be no reason that you would have to disclose if you're not sick or you're asymptomatic, or you're not so sick that you can't work. Then I generally speaking wouldn't see any reason that you would necessarily need to let your workplace know. It's more focused on if you're going to the workplace, making sure that they have the information that they need to to warn and quarantine other people, and then of course if you are seeking to avail yourself of any of the leaves or other benefits that are specifically related to COVID-19, then of course you'd have to disclose that to the appropriate people to be able to take advantage of those.
Great. So this kind of next section is really talking about, I have coronavirus and what do I do? So the first question here is, I think I have coronavirus and I need help paying for medical care. So where do I look first? Oh, I think you are muted, Clorinda.
Sorry about that, I was muted. There are so many organizations that are right now focused on providing financial assistance to people either diagnosed with COVID or that are in the classified group that would be more susceptible to complications of COVID. Again, Good Days is one of those organizations, and we're very excited that we have donors that have allowed us the opportunity to provide $250 to anyone who is either, again, diagnosed with COVID or has a chronic illness and would be susceptible to the complications of COVID. And again, that $250 can be used for your premium assistance. It could be used for rent. It can be used for food. And, again, outside of Good Days, I was just researching the last few weeks. There's about 10 other organizations that'll provide up to $500 to be used for any of those types of things. Again, it could be used for transportation, for food delivery. So I highly encourage, you can visit mygooddays.org. And again, we'll give the Mighty a weekly update on the different types of assistance that are available. And again, applying for this assistance is very easy. It's information that most people have readily available. And again, we're here to help and we want to help. Don't hesitate, again, to reach out to Good Days. And again, if it's not something we can help you with, we'll try to connect you with an organization that can provide the type of support that you need.
Great. So what about health insurance? A lot of people are losing their health insurance because they were laid off. What do they do when they need to pay for these out-of-pocket expenses that they thought were going to be covered before and now aren't?
I'll add to that as well. So the organization that I'm talking about, so also outside of just COVID support, there are many organizations that'll help cover premium assistance for certain disease categories. So if you're suffering from a chronic illness or a rare disorder, many types of cancer, there are specific programs that will cover your out-of-pocket premium costs for a calendar year. So again, I highly recommend that you go to Good Day's website or reach out to us and we can direct you. Most of the time it's disease specific. And so we can look and provide some research to say, okay, here's some organizations that would be able to help with covering your premium to get you through the calendar year.
Great. And so what about for people who maybe they don't need their treatments due to COVID directly, maybe due to some other chronic illness or cancer or something like that, they have treatments, but maybe they've been laid off. Is there anything additional that those people can do to afford those treatments, or where to start looking?
Oh, absolutely. And again, so there's so many disease-specific programs that are out there, and they kind of fall into two different categories. So if you are insured through commercially, so through not a government-supported insurance like Medicare or military coverage, many times you can go directly to the manufacturer of the medication or treatment that you're taking and gain assistance from them. They might be known as coupon cards. So essentially, what many of them do is they'll cover almost the entirety of your copay and allowing you to get the medication either at an affordable rate or at no cost at all. With the programs that Good Days supports, we provide financial assistance for different disease categories that will cover treatment for a calendar year. And we work directly with the pharmacy or the provider's office to pay for to pay for your premiums or to pay for your copays, so you don't have to come out of pocket. And again, many are disease specific, and we're in process of creating that list, and we'll also post it. And it's very easy to find. You can either put the medication or treatment you're taking or your diagnosis, and it will provide the different types of resources that are available to you. But again, depending upon the type of insurance you have, there's so much available to provide assistance to.
Great. And just so you guys know, in the community, we are about to wrap up. So I have a final question, and then we'll get some final thoughts from panelists if they have any, and then we're going to sign off. So my last question is, what about getting to and from important medical treatments? Is there transportation support or assistance available for that as well?
I can add to that as well. So again, the dollars that Good Days is given, so the $250, you can use it for whatever life expense you have. So you can use it for transportation. We also work with Uber and Lyft on the healthcare division to ensure that the drivers that are taking you to and from your appointments are familiar and are taking all the appropriate steps to mitigate risk on getting you to and from your doctor's appointments. You have cancer care. There's the SAM Fund, Patient Access Network Foundation, HealthWell, all of these organizations providing these dollars so you can use them in whatever manner you feel is necessary to get you, again, to your appointments back, to pay for any healthcare expense or just everyday living expenses. And we're here and we want to help. And don't hesitate to reach out to us if you're looking for something and you can't find it. We help you navigate.
Awesome. Well, thank you. I just wanted to check, we are wrapping up now, but if there's any last thoughts, Hannah, Clorinda, Shelley, that you would want to share with the community during all of this.
I need to say that if anyone's looking for,
I think you're having some mic difficulties, Hannah. It's kind of glitching.
Let's see. Now can you hear me?
Yes.
Oh. Now you can?
Now I can. Oh,
okay.
Now it is.
Sorry, my AirPods died during
delayed,
this.
But okay.
I was just going to say that anyone who is currently searching for a job, to feel free to reach out to me. I'm there to support the community and happy to help answer any questions in regards to getting your application ready. Employers are still hiring and there are positions available. So anyone that needs support, please feel free to reach out to me. I'll make sure to add that in the comments as well.
And from the Good Days team, again, we're here to help and we want to provide any support that's needed. You can go to mygooddays.org and live chat with any one of the Good Days family. And again, if we can't provide the assistance you're needing, then we will certainly work hard to connect you with an organization who can.
And I was just going to say, one of the things that, that we talked a lot about earlier in the program was the fact that, that this has caught a lot of employers and a lot of businesses and really all of us, off guard, and people are kind of learning on the fly and trying to figure out on the fly what's best. But I think what's really interesting is that, you know, many of you who are on this program, you know, perhaps have been, you know, kind of living with, you know, living with illness and, you know, this type of thing for a long time. And so, you know, in a lot of ways, you're uniquely positioned to, you know, to be able to offer some really helpful insights and ideas, you know, perhaps to your employers or to your workplace about, you know, what has worked for you to allow yourself to, you know, be productive in a remote work environment. You know, if you've perhaps been, you know, doing that for a long time and now your colleagues are, you know, just starting to get up to speed about that kind of thing. And so, you know, I would just say that, you know, although there are certainly a lot of downsides and a lot of difficulties with respect to this situation, you know, that some of you may be, you know, really uniquely positioned to, you know, to be an important voice during this time, that, you know, to help your workplace and your employer, you know, to figure out how to adapt and be more accommodating.
Absolutely.
Yeah, well, thank you all. I do want to also just mention that the Mighties also, if you're here, you're familiar with our resources as well, and our apps and our groups, that you can also find the support that you might be looking for as well. So thank you all. Thank you, Hannah. Thank you, Clorinda. Thank you, Shelley, for taking this hour to chat with the community. We have a thank you from Bonnie as well for just giving some great advice, great resources to people when they really need it. So I hope everyone has a really great weekend that they're jumping into, and we will talk to you again soon. Thanks all.
Take care, everyone.
Thank you.
Bye.